new to shockwave. I came across shockwave really just coincidentally, and we were fortunate. Very early on, we partnered with a company called Storz to get into this, and I was put in contact with an excellent. Actually, I think Kiki Hauser from Stuttgart was has done one of your Facebook lives, I think, at one point. And
no,
Kiki,
she hasn't yet.
Oh, she hasn't done it yet. Oh, I thought she'd done it.
No,
you need to badger her. All right,
to.
Kiki, you're on warning. You're on notice. Well, Kiki is an expert. She's a rehab specialist from Stuttgart in Germany, and is an expert on the use of shockwaves. Done it for years, and sort of under the radar a little bit. And we were able to partner with her, and actually then with Storz do some work on that. And so we've come into, what I like about it is the fact that, as you say, it is equipment that is not broadly available, but it is available. It's affordable in a private practice setting, not just a specialist practice setting. The other things I really like about it are it's not a toxic treatment. There's no pills being popped. There's no chemicals going in the system. And if it doesn't work, you stop. There's no long-lasting ill effect. So it's very what we call low invasive and low risk. And so I really like it for that reason. So that's a good reason to start looking at it. But what we found is that actually it can be very, very effective in managing some of these dogs. Again, rather like pills, not every dog. And a lot of our future focus is going to be trying to understand what characteristics of a dog and a particular dog at a particular stage of disease makes it a good versus a bad candidate. Because much as cancer therapy has gone, what we're going to see is an evolution. The thing I'm excited about is personalization of veterinary care. So we will not just assume that Millie the dog, because it's 8 and has osteoarthritis, is going to get tablets in the box marked 2. We're going to give Millie what Millie needs based on information that maybe at the moment we don't have or we don't recognize. So that's what we're going to focus on with shockwave. Shockwave is not a new therapy. It came out of Germany originally, working on the use of sound waves to destroy kidney stones, actually. And so kidney stones, when they form, they use a thing called lithotripsy, which is basically high energy sound waves are fired into the patient from outside or from inside, depending on the technique. And they actually blast into these solid deposits of material that form the kidney stones and destroy them. And coincidental with that, they were looking at some studies of patients who'd had that done. And what they found was that in some of these patients, there were some interesting changes in the bone that was adjacent to where the kidneys are. And they recognized that this might be associated with these sound waves that they've been firing in. And from that sprang this idea that shockwave can have an effect on tissues, not just a destructive effect, but actually a reparative effect, because these bones were showing signs of building new bone, of getting stronger and of repairing.